My name is Alicia Jennings. I'm an internal medicine physician. I work at Tanner Internal Medicine of Villa Rica. When someone comes into my practice, they can expect friendliness, for one, but I think the biggest thing is they'll receive a nice amount of time with myself and the other ancillary staff. I think a lot of times when patients come to see a physician, they feel like they don't get enough time to talk about all of the issues that they have, and they'll receive that certainly here. I used to work as a hospitalist for about 4 years, and in that interaction you don't get to know the patients, whereas in this practice the patients are seeing me on a regular basis, and so there's a bond that you're able to build with the patients. When you work in private practice, the bond that you develop with your patients is almost close to family. You know, you get to know them. A lot of people I see, from the husband and wife, their kids, and sometimes the grandparents, and so you feel a certain level of kinship with them, although you're not truly family members, but you start to feel like that with a lot of the patients. And I think for me, that is the most enjoyable part, where you are able to see them when things are good and also when things are bad, and so you're there for the entire process. What is essential in patient care, one, is certainly knowledge base. And so you certainly want to have a good fund of knowledge in terms of internal medicine, but in addition to that, you want to have a good bedside manner. I think patients appreciate knowledge base, but they also appreciate someone who is compassionate and someone who listens to them and is not trying to rush in and out of the room. So I think a combination of the two is important. Tanner is good in that they are employing various specialties and subspecialties, and so you don't have to leave the system to see a specialist. We all talk to each other, and so there isn't a lack of continuity of care. And I think that's the best thing that Tanner provides.